Hello everyone and welcome to Health Scare in Germany. So, have you ever heard people rave about Germany's wonderful universal healthcare system? Yeah, me too. So not by choice, I found out that it's not as magical as it might seem. And along the way I discovered phantom students, health insurance heartbreak in 55, and why some people literally quit their dream jobs to work behind the cheese counter at Edeka. If you want to find out more, stick around till the end. So let's dive in. So here's how it works. Around 90% of Germans are insured in the public health insurance and about 10% are privately insured. I'm going to focus on the public side because that's what most of us buy. Germany has over 90 public insurance companies, all competing to offer you pretty much the exact same thing. They're not identical because that would make life simple. Where it gets interesting is when you work as a freelancer, and I'll explain a little about that shortly. If you're employed, congratulations, you only pay half of your healthcare insurance. Your employer picks up the other half. The standard rate is around 14.6% of your gross salary, so your share is around 7.3%. That's the solidarity model. Except civil servants don't pay into it. This is something I find quite odd, as people constantly talk about the model of solidarity that exists in Germany. Yet the richest of the population get to opt out of the public system. If you're an artist, a writer, a journalist, you can apply for the Künstlersozialkasse, the Artist's Social Fund. Insured artists and writers pay contributions at the same level as any regular employee. It sounds like it offers great protection, but just a word of warning. Have patience if you want to apply to this fund. I know of 2 people who waited over 6 months and then were finally denied coverage. Reading the prerequisites and figuring out who's entitled to coverage and why takes longer than listening to Wagner's Ring Cycle opera, and that thing is literally 15 hours long. Now, if you're self-employed, Germany smiles sweetly and says, you're independent. Great, that'll be 100% of the cost, please. In other words, you pay for everything yourself. They then even calculate a fictitious income of €1,248 per month, and 33 cents, I should add. That's right. Even if you earn less than that sum, they pretend you earned it anyway and bill you accordingly. The minimum? Around €250 a month. So let's say you make 800 on any given month, you're paying just almost a third to stay insured. And if you don't report your income correctly, perhaps because it fluctuates or you dare to have a slow month, you might get a surprise letter from your insurer saying, hey, you owe us €1,000. Back payments are common and have got many of us into debt. And here's a fun twist. If you move to Germany and forget to register your health insurance right away, you will also owe back payments. Yes, you'll get charged for the months you didn't even know you were supposed to be insured. Surprise, bureaucracy never forgets. Now, on top of health insurance is also an obligatory nursing care insurance. If you're over 23, that's around 3.6%. And if you're childless, you pay 4.2% nursing care insurance. If you lose your job, you will still need to be insured. If you're registered as unemployed, then welfare might well cover it. If not, that's another €250 a month, please. And despite Germany's reputation for universal coverage, there are still thousands of uninsured patients. One GP in Hamburg even set up a clinic just for them. So much for universal. Now here's where the story gets wild. Because of the high self-employment costs, some entrepreneurs actually quit their jobs and take salaried jobs, like working at the cheese counter at Edeka supermarket, just so that their employer will share the insurance burden. At least that's what a former owner of an independent language school decided to do. Imagine that. I left my startup to pursue my true passion, selling Gouda. And then there are phantom students, people who enroll in university just to get cheaper transport tickets and other discounts usually offered to students. When I first heard this, I thought, surely not. But German friends told me, of course, it's perfectly normal. I was advised to do this by German friends when my contract was about to expire. I was panicking about not finding a salaried job, and I was told that if I registered as a student, I'll get discounts elsewhere, which will compensate somewhat for me paying several hundreds of euros a month for health insurance. You see, foreigners have it drummed into them that Germans follow the rules, that the system works, and that everyone acts out of solidarity. Whereas in reality, many Germans, through their connections or their wealth, find a way to get around the rules and escape them. And they can then escape from some of the draconian and punitive measures in place. So while foreigners like me think Germans always follow the rules, many Germans are out here mastering rule bending as an art form. Private insurance might sound tempting after all that, but there's a catch. It gets more expensive as you age, and after 55, you can't generally switch back to public insurance. So yes, Germans actually dread turning 55, not because of middle class or midlife crisis, but because of premiums. So what's not covered by your shiny public insurance? Just little things like teeth cleaning, fillings, implants, vitamin tests, certain blood tests, hormone tests, eye exams like the optic nerve, your organs like heart and lungs, basically anything your body might actually need. My dentist once told me that I could send my €90 teeth cleaning bill to my insurer. Their response? Sure, if you're under 25. I'm not. You do get a free health check every 3 years, urine and blood test, very glamorous. Things like high blood pressure, cholesterol, diabetes are tested. But preventative care? Minimal. Meanwhile, in the UK, if you're over 40 and have a history of glaucoma in the family, you get free eye pressure tests and free optic nerve tests. In Germany, that'll be €105, Dankeschön. Even my GP admitted that really should be covered by your insurance. Then he added, if only other doctors would protest, I'd take to the streets. I'm still waiting for the healthcare revolution of 2025. So, what's it like being a patient? The good news first. If you call an ambulance, it comes. Doctors are on the whole well trained, unless they're training to be a gynecologist, and procedures are pretty logical once you finally get through. But the average consultation time with a GP is around 7 minutes. So you better show up like it's a job interview, have your notes, your questions, your timeline, your evidence, all there. You know what I would recommend? Being your own doctor. Prepare a list, as I said, of questions and research. Go into your consultation with this list and suspicions that you have, and expect to waste a significant portion of your time getting second appointments, chasing people up, and feeling crushed and exhausted. But why? Firstly, waiting times for specialists can be quite long, something like 6 weeks to 3 months on average. Unless you're privately insured, of course, and then it's more like, please, can you come in this afternoon? Yes, there is a healthcare class system in Germany. Secondly, there's a real lack of communication and consultation. Reports are simply not forwarded or forwarded very late. My GP hadn't received my report from the hospital, which was done 3 weeks prior to my consultation with him. A colleague of mine whose son was very ill in hospital almost resorted to taking her head doctor to court because he hadn't communicated with his team, effectively endangering her son's life. And as for bedside manner, let's just say that some receptionists are as friendly as a pregnant ant with lumbago carrying heavy shopping bags. I changed gynecologists as in my former practice they used Siri to answer the phone and take messages, despite having 3 women behind the counter pretending to act busy every time a patient walks in. Yet in my current practice, the receptionists aren't capable of smiling and saying hello. The standard greeting is "Bitteschön," delivered with all the enthusiasm of someone who has just stubbed their toe. Women's health sometimes feels like it's back in the Stone Age, and the attitude of many gynecologists is no more modern. If you aren't pregnant, you don't want to be pregnant, you're basically a waste of time and space. You can have a smear test once every 3 years, but it has to be 3 years to the exact month. I learned the hard way. So let's say you had a test in November 2022, the next one must be in November 2025, otherwise our lovely shiny health insurance won't pay for it. When I questioned this and asked if I could come a month or 2 early, still within the 3-year period, because I had some worrying symptoms, my gynecologist just looked at me and said, "You still don't get it." I guess I don't. I thought prevention was the whole point. So there you have it. Germany's healthcare system is a beautiful mess. It's dominated by knee-jerk reactions and high costs. It's bureaucratic. It's logical and totally illogical at the same time. It's a system built on solidarity, unless you're a civil servant, self-employed, or over 55. But hey, at least your ambulance will come on time. And remember the strict rule-following and rigorous Germans? Well, here's another example to finish. Doctors who are struck off the list and lose their license still somehow manage to keep working in Germany. A recent study organised by the Organised Crime and Corruption Reporting Project discovered that 30 German doctors who had been struck off abroad are now back and working in Deutschland. Moral of the story: if you want to move to Germany, read the fine print, register early, choose your doctor wisely, and maybe, just maybe, keep a backup plan behind the cheese counter. Thank you so much, ladies and gentlemen. See you next time.